Good afternoon, everybody. Respected chairpersons and ladies and gentlemen. My topic of this free paper is cellular modeling in enucleated eyeball optic nerve, future drug delivery vehicle in glaucoma. Myself and all my co-authors do not have any financial or commercial interest in any of this material discussed here. Now, when you do a stereoscopic optic disc recording and color red-free photograph, we see the peripapillary changes along with the, in this model setting, you can see a enlarged disc here. But when you see this model setting in enucleated eyeball optic nerve, we see the peripapillary cells, pigmented cells that are evident here. Now, when you took a cut section of the optic nerve in a diffractive photography, we see the pigmented cells which are in a concentric pattern, and this is the subject of interest of this study. And when you did a hematoxylin eosin stain in a postmortem eye of enucleated eye, we saw that pigmented cells are evident in this glaucomatous eye. Now, this optic nerve head, as we know, is directly susceptible to intraocular pressure elevation. It is the optic nerve head and the nerve fiber layer containing the retinal ganglion cells, axon, most evidently linked with glaucomatous visual loss. Computational, cellular, and mathematical modeling is a newer method to understand the human biology and system. Till date, there are many drugs that have been used in medical management of various glaucomatous conditions. Peripapillary uveal or dendritic cell were not previously explored as a targeted site in anti-glaucoma medication. The aim of the study is to present the cellular modeling in an enucleated eyeball optic nerve and its understanding that can open up an idea for future potential drug sites in glaucoma. This study was a laboratory-based study. Analysis of enucleated eyeball optic nerve in gross pathology, stained, and immunohistochemistry was done. Total 8 enucleated specimens from 7 patients for various indications were taken, and 2 postmortem eyes were taken in this cohort. Optic nerve was studied by advanced microscopy, routine stain, and hematoxylin stain, diffracted photography, and immunohistochemistry are done. The peripapillary cell, trabecular meshwork cell, and retinal ganglion cell were studied with immunohistochemistry. 5 cases had clue of glaucomatous change. 1 post-trabeculectomized eye with history of trauma and painful blind eye. 2 other cases removed from painful blind eye with raised IOP, which included 1 thicycle eye. Other 3 were different indication removed in operation theater after consent. The age of the patient varies from 13 years to 79 years. Male were 5, females were 2. Now, these pigmented cell size, shapes, and direction and advancements were documented. Peripapillary cells were varied from 90 to 170 microns. Peripapillary cells were centrifugal configuration, and trabecular meshwork cells were mostly dendritic pattern. We did 3 molecules, BAX, BCL2, and CD68 for these 3 zones of involvement with a standardized kit method that we did for ICMR project, and educate control were taken for each samples. In discussion, it is well known that optic nerve consists of axon as well as astrogal cells and collagen. Connection between these 3 zones, RGCs, optic nerve, trabecular meshwork, may exist, and BCL2, BX, and CD68 for dendritic cells showed their expression in glaucomatous as well as the control eye. In 1 traumatic eye, there was a reaction was exaggerated, +3 reaction in these 3 molecules were seen. We knew that peripapillary pigmented change in zone alpha beta is frequently associated with optic nerve, and also this condition can be associated with myopia aging. Mastropask et al. From Italy has shown that confocal imaging in vivo dendritic cell expression staining with corneal and limbal cell, and our study showed expression in optic disc cells, retinal ganglions, and trabecular meshwork. In conclusion, as dendritic cell expression in optic nerve, peripapillary cells, retinal ganglion cell, and trabecular meshwork were seen in our study, this cell can possibly act as a future targeted drug sites in glaucoma. These are my selected references. I like to acknowledge our patient, Shri Shankardev Netralaya Pathology Lab, Professor Deka, Apurva, the technologist, Shainur, the glaucoma consultant, and Saurabh, the residents, for this presentation. Thank you so much.